Welcome to Conversations on Healthcare. This week we welcome Dr. Jennifer Nuzzo, Inaugural Director of Brown University School of Public Health's new Pandemic Center, on getting this pandemic under control while preparing for the next one. Now, here are your hosts, Mark Masselli and Margaret Flinter.
One expert said the end of COVID pandemic is not like a sporting match. There will not be a whistle telling us it's all over, but there is a process and data that are essential to helping us understand where we are in the situation as we head into the fall.
Joining us to break down these details is Dr. Jennifer Nuzzo. She's leading a new effort on pandemic preparedness and response at Brown University School of Public Health. And Dr. Nuzzo and her team are working to address the urgent issues that have been exposed in this pandemic and are intrinsic to every pandemic.
Dr. Nuzzo, welcome to Conversations on Healthcare.
Thanks for having me.
Yeah, we point out that the White House Corona Response Coordinator, Dr. Ashish Jha, hired you when he was dean at Brown, and his boss, President Joe Biden, said the pandemic was over in an interview, and then tried to clarify his words by saying it's basically is not where it was. The U.S. is still averaging over 400 COVID deaths each day. So where do we stand on this question? Are we still in a pandemic?
Yeah. So first of all, when I first began the thought and conversations with Ashish about coming up to Brown to work on pandemics, it was actually in between where we saw a rise in cases and then the subsequent really meteoric rise of the Omicron variant. And that just tells you that even when the case numbers are low, even when perhaps there's a glimmer of hope in the future, it's worth still working on these issues and digging into them because, even if the virus were no longer part of our daily thinking, there's going to be more pandemic threats in the future. And we need to make sure that we're never again, caught so vulnerable in the ways that we were for this one. But in terms of this one, look, it's still clearly a significant health threat. The fact that we have more than 400 Americans dying each day, thousands of Americans each week is really, something quite serious and something that we have to continue to do work on. Are we in the same situation as we were in 2020? Absolutely not. But that's as a result of the hard work that we've done over the past 2 years. And I guess one of the concerns that I have is that we're headed into a fall where we could see a rise again in terms of the cases, which happens every fall, winter. And many of the tools that we have used in order to make COVID not what it once was are possibly going to become increasingly out of reach for people. And so really what happens in the future is up to us and to make sure that we continue to work such that people who get up to date on their vaccines, and we make sure that all tools are available to everyone who needs it. And there's still a lot of work to do to make that happen.
Well, Dr. Nuzzo, walk down the street in most of our cities on a beautiful day, see restaurants are full, people act like the pandemic is over, people are back in offices, kids are in school, and yet we see these numbers of cases. When do we get to declare the end of a pandemic? What would be the measure for that?
Well, it's important for people to know that from an epidemiologic perspective, and I'm an epidemiologist, so I'm going to tell you that first, that when we use the word pandemic, what we really are describing is geographic spread. So by that measure, this virus isn't going away. It will continue to, infect people around the world. But what is changing is a different dimension of the pandemic, which is how much this virus has the potential to upend our lives. The fact that people are living differently than they were 2 years ago signals progress to be made. Whether we stop calling it the pandemic, I think is probably going to be more of a social and political decision rather than a true epidemiologic one. And I say that because the virus that caused our last pandemic, something that happened in 2009, the H1N1 flu pandemic, which I'm finding a lot of people have forgotten about. And that probably just goes to show you what the answer to this question is. That virus is still with us and continues to sicken people every single flu season. So the fact of the matter is these viruses are not going to go away, but with tools like vaccines and therapeutic drugs and tests, we can better manage them such that they don't pose as much of a risk to our broader community as they once did, and that the ways that we deal with them is not just simply don't go out, don't see people, don't go to restaurants, et cetera. We just have more options for protecting ourselves than we did 2 years ago.
Well, I appreciate you mentioning the importance of people getting vaccinated for the flu, and it does have and can have a profound impact on the health and well-being of individuals and in the country. You said a moment ago that obviously as we come into the fall, we'll see some spikes, but the Washington Post recently reported that a major fall COVID surge is unlikely. But clearly, variants will be a wild card. What's your take on the situation, and what should we be prepared for? I know there's a variant that's been moving over from Europe over to the United States, and some suggest that it will move out and take over where the two variants are right now.
Yeah, so I'm not sure that I can say that a surge is unlikely, in part because what's major and what's likely. In part, what's likely depends on what we do between now and then with respect to vaccinations. And one of the things I am most worried about is that we have a large gap in coverage of booster doses among the people who are most at risk of severe illness. So the fact that we have, people over the age of 65, 30% of them who haven't gotten boosted, and about 60% of them who haven't gotten a second booster is a real worry. And so if we want to make sure that we have a fall and winter that's not marked by rising hospitalizations and deaths, we absolutely have to double down on making sure the people, in particular, the people who are at greatest risk for severe illness and death, get boosted. Not to say that others can't benefit, but if we do nothing else, and we shouldn't only do this, but if we do nothing else, we have to make sure that those who are at greatest risk of severe illness and death get boosted. Will we have another Omicron level surge? I don't think so, but I actually didn't expect us to have a surge that great. So I'm a little bit humble in terms of my predictions that it won't be as bad. I do think that the amount of immunity we've amassed in our country, both through vaccinations and the infections that have happened do, I think, blunt a level of severe illness. And in my mind, what I'm most focused on is making sure we keep people out of the hospital and keep people from dying. It's really hard to prevent infections, not that we shouldn't try, but we absolutely have to make sure we don't let people get hospitalized or die. And there's much more work we need to do to make sure that doesn't happen this fall and winter.
Well, I want to second your sentiment that COVID has been humbling, certainly has been humbling for all of us. But I was curious about a comment that I think was ascribed to you, that there's 3 ways to prepare society for the next pandemic, and that they hark back to the Great Baltimore Fire of 1904. I've heard a lot of reference to the Great Flu pandemic of 1918. Haven't really heard this reference back to the Great Baltimore Fire of 1904 and ways we might prepare for the next pandemic. So explain these ideas to us.
Yeah, so this really came out of, I was actually given the privilege of being asked to give a TED Talk, and they asked me what I wanted to talk about. And it was almost about a year ago to the date. And at the time, I was actually quite worried that COVID was starting to fade from the headlines. The cases were falling, but there was still more work we needed to do to not just address the continued hospitalizations and deaths that were still happening from COVID, but also to make sure we never have to go through an event like COVID ever again. And there's a lot of, hard work building the medical and public health infrastructure and other things that we needed to do. But I was really worried that people were starting to forget in a way that almost seems unimaginable given all that we've gone through. So I was looking for a way to try to describe to people or make clear that just because COVID may end, and we started the conversation asking about when it ends, it may end in the sense that it no longer consumes our daily thoughts in the way that it once did. Our vulnerability to infectious disease emergencies remains. And in particular, we are seeing an increase in the number of infectious disease emergencies that have been happening over time. And so I wanted to make people aware that just because COVID may sort of fade from the headlines, it doesn't mean that we're safe for the next 100 years. COVID sometimes called a once in a century crisis. It's actually, I don't think a good description. I think it's actually a wrong description for it. But I didn't want people to somehow think that once COVID's over, we've got 99 more years of being safe until we have to worry again. So I was looking for analogies. what are other hazards that we encounter and prepare for that once they're over, we don't just assume that we're safe once they're done. And fires was actually something that became an area that I was looking at. And then the more I heard about the Great Baltimore Fire of 1904 and how really devastating that one event was, but also how catalytic that one event was in terms of changing how we as a country deal with urban fires, such that now we don't have them nearly as frequently as we once did. If you've gone to museums, you often hear about great fires of right. yore that devastated communities on a somewhat frequent basis, but now are not nearly as frequent. And part of the reason why they're not nearly as frequent is that we rolled up our sleeves. We did a lot of hard work to make ourselves protected. And so I identified 3 areas in which the country committed itself to action after the Great Baltimore Fire of 1904. They were in the area of data, drills, and defense. And, I posed that if we committed to action in those 3 areas, we would be much less vulnerable to the recurring hazards of infectious diseases, and that we could deal with a future that may see more and more pandemics, but that we wouldn't be as vulnerable or experience the same severity of impacts as we did during COVID.
Better than the 3 100-year storms that we get in a month, the sort of wearing on people. So that's a great reference point. I think I read that you grew up near where a polio outbreak is now occurring in New York. And of course, we had a polio vaccine for decades, and the disease had practically been eliminated in the United States. But this gets to the heart of the vaccination education campaigns that have worked in many cases, but still seem to have resistance in some communities. And I'm wondering if social science can better help all of us in the public health try to break through with anti-vaxxers, people who are resistant to getting vaccines, with some new strategies. Just telling them the facts and urging them to get vaccinated doesn't seem to be working.
No, it doesn't seem to be working. And I was so disappointed to learn about polio returning to the U.S. and particularly circulating in communities that were so close to where I grew up, in part because I always heard growing up from my mom, who was actually very proud throughout her life that she had been part of the early polio vaccine trials. She always used to tell me with pride that she was a polio pioneer, and she just really kind of appreciated that she got to contribute, and did her civic duty for something that was very much feared, particularly by her generation. I think many people who grew up today have never met somebody who's experienced polio. I did. I mean, people in my mother's generation certainly were affected by it, and many people who had, lifelong consequences of those infections. So it was very much a feared thing. And so for a generation of people to be able to participate in developing a tool that would take off the table polio's abilities to kill or harm people for life was something very much a point of pride. So it's unfortunate that people haven't lived with that same fear because they don't then be able to compare that to the benefits that vaccines offer. I think we have to, though, not just talk about fear, because that's not a really great long-term motivator. I think we do have to figure out what are people's motivations and figure out how to better reach them. Many of us have been engaged over the past 2 years talking to people about vaccines, and I am hopeful that we can actually make more progress in convincing people of the benefits of vaccines, but we need to have more evidence-based ways of doing that. And it's going to take all of us. This is something that's probably need to be done from the ground up rather than the top down. And so the more evidence and guide that we can all use to have these conversations, I think the better. And that's really where I think social science research comes in. And if we do nothing else after this pandemic, investing in how to reach people and talk to them about risks, including how to protect themselves from it using vaccines, is, I think, a really important, pandemic lesson.
Dr. Nuzzo, you're obviously engaged in a lot of leadership activity in your roles in public health, but one of them is that you co-lead the Global Health Security Index, which, for people not familiar with it, it aggregates publicly available data to create a picture of at the national level, health security gaps from 195 countries. Maybe share with our audience a little bit more about what the intent of the security index is. And what do you say to some comments I think that British Medical Journal has said recently, that it gives a false sense of security to some nations and maybe undue criticism to others?
Yeah, so we started the Global Health Security Index a number of years ago. We published the first one in December 2019, so just before the pandemic. And what we really set out to do was create basically an inventory of the capacities and to some extent the risks countries have about future pandemic threats, not just pandemics like COVID, but other types of threats, including deliberate outbreaks, something that could be intentionally caused. So really threat agnostic, but capacity focused. And we were doing this in part because, work has been underway for many years to try to strengthen countries' abilities to respond to not just threats like COVID, but Ebola and flu seasons, all sorts of types of events. But we know that not all countries have the same capacities. And that was actually made quite clear during COVID when we saw huge differences in how much testing countries did to identify infections. And the fact that there's so much discrepancies between the amount of testings countries did gives us a very different impression of how countries have been infected, in part because we've just looked for it, the virus in different ways and to different extents. So we published the first index just before the pandemic. And what we concluded in that analysis was no country had everything. In fact, there were many important gaps in all countries. Of course, when we saw the pandemic unfold and we saw countries that scored higher, like the United States, really struggle to respond to COVID, that was deeply disheartening. But it also wasn't surprising, in part because we knew that even the top scoring country like the United States had really important gaps. And really any of these gaps can be, paralyzing in some ways. But that's actually one of the things that made me start thinking about fires as an appropriate analogy, because the index basically measures the tools that countries have, and to some extent, what risks they have. And so if one of the tools, let's say you're trying to create an index for a fire, if one of the tools you measure is a fire alarm, and if you want to look at the risk for fire and you look at, perhaps whether there are, building codes that require the installation of fire alarms. That's, you could imagine, quite important for understanding how well a country may do in a pandemic, but we don't, or in an emergency like a fire, but we don't actually measure whether countries are going to use the capacities they have or whether they will use the capacities they have. And so what we saw, unfortunately, during the pandemic was many countries like the United States chose not to use the capacities that they had, which was quite unfortunate, because if going back to that fire analogy, it's sort of like they had the fire alarms and the alarms were going off, but they just chose to sit there and remain in their seats despite what the fire alarm is. And so we don't measure that piece, whether we will evacuate the building when the fire alarms go off. Unfortunately, that capacities aren't the only thing. It's how you'll actually use them that also matters. So my hope is that it's a wake-up call for all countries, and that all countries could benefit from improving their capacities. But when an emergency happens, they have to actually use them. And just having them doesn't mean they're going to be okay. It requires a commitment to using them, a commitment to continually strengthening them and exercising their use, just like we, do fire drills, just to make sure we know what we're doing.
Well, we expect when the fire alarm goes off in the fire department, they'll respond. And if they don't, that's scary. You're also involved with the Outbreak Observatory, which it really is focused on collecting information on challenges and solutions associated with the outbreak response, and shared broadly with the public health preparedness and response communities. And I'm wondering, are we learning more about how China handled or mishandled the initial COVID outbreak, and how can we expect a different response as we think about societies that aren't as transparent?
Yeah, I think clearly the initial response to COVID, not just in China, but in many countries, was not what it needed to be. I think in particular in the instance of China, the thought that there may have been more information that was shared publicly is inexcusable, frankly. We all depend on each other, and we all suffer when we don't share the information. So that is, I think, a clear lesson that has come out of COVID, is that we need countries to first have the capacity to do tests and to gather data. That is a clear first step. But then once they have that information, to be transparent and to share that with others, that is also a second step. I think there are some other lessons that we saw later in COVID, in fact, actually during the Omicron wave, where there were some countries that really leaned in terms of collecting data and sharing that with the world. And I'm thinking too, South Africa is sort of alerting the world to the discovery of the Omicron variant. And that was really heroic and extraordinarily, helpful from a public health perspective. But then what happened afterwards was actually the opposite of that, which we saw a number of countries, including the United States, implement really harmful travel bans that, struck at the kind of economic consequences for South Africa for having shared that information. But also, hindered the supply, the transport of important, laboratory reagents that the scientists were using in order to tell us more about the Omicron variant. So I think that really speaks to the fact that we still have a number of important sort of governance and policy barriers that may deter countries from being forthcoming with information that they have about outbreaks or situations that are happening within their borders. And, we really also have to work on eliminating those barriers if we're going to expect countries to be forthcoming with what's happening.
Well, Dr. Nuzzo, even as we look forward to COVID quieting down and hopefully getting a handle on this, some have suggested that maybe we're just living in a new era of pandemics and that they will continue and they will be more frequent. Are you in alignment with that thinking? And if it's the case, are there some fundamental ways you think that society will change to adapt to that kind of environment?
So I do. Unfortunately, I do. We live in an age of pandemic threats. These infectious disease emergencies, and we talked about COVID, but we also mentioned polio. We see an increasing frequency of new diseases emerging or old diseases reemerging that threaten our public health. They don't all become pandemics, but some of them can. And that just means there's probably more pandemics in our future. So that's very much the bad news. But the good news is that I absolutely believe that there are important steps that we can take that will reduce our vulnerabilities to these threats. Again, I could go back to that fire analogy. It's not that the risk of fires went away. It's just the US, after the Great Baltimore Fire of 1904, undertook steps such that we are now, as a country, less vulnerable to large urban fires. And we can do the same for pandemics. We can take steps such that we detect these events much earlier, that we can tell people how to protect themselves in a way that hopefully that's not just, stay home, don't go anywhere, but give people tools in order to protect themselves so they can continue to live despite the presence of a new pathogen around them. And that we have a defense force. You talked about the fire department. One of the problems is that we went into this pandemic with a defense force, our public health infrastructure, that was really decimated due to continued funding cuts year after year after year. You can't fight an emergency with that. You can't just hire a bunch of people in an emergency and expect that it's going to unfold. No, we have to resource and staff public health agencies for the emergency in advance. There's plenty of stuff they can work on day to day to make our communities healthier and safer, but we need to make sure there's a large cadre of very trained professionals who can act in a way that protects us. Oftentimes, sort of even out of sight in a way that doesn't necessarily impact our lives, but we very much need that. And, I think we're having conversations about other sort of in the background protections that we can put in place, like improving the quality of air in our buildings. And, the pandemic has ushered in the availability of tests for people to test themselves at home. And this just gives people more power to continue to live despite this recurring hazard of infectious diseases, but in a way that they can do so more safely. And, I think we need to work towards that vision such that we don't put our lives on hold, but we also don't succumb to these repeated viral threats in the process.
I want to sort of pull on the thought that you just said that we need better trained health professionals. And I note that you, one additional silver lining perhaps in the COVID experience is the increase of students studying public health. And they have a real interest in being part of the solution. And maybe what's the biggest lesson they need to learn as they prepare for their careers?
Yeah, so I think it's really heartening that many people now understand what public health is. I joked, often joke that I used to have to tell people that I was an epidemiologist, and explain to people what that was. They usually think it has something to do with the skin, but now people know what epidemiology does, what epidemiologists are. So it's great that we have this, heightened understanding of what public health is. I think for future public health professionals, I think there are a few lessons. One is that, it's important to think about the virus, but we also have to think about the people and the systems in which the virus circulate. And it's not just, kind of one or the other. We need to recognize that much of our vulnerability to viruses is in part the structure of our societies, the fact that we don't all have equal access to the tools that we can use to protect ourselves. So we have to work to serve people and meet them where they are, and fill the gaps in terms of access. The other thing is that I think a key lesson for me is that a lot of people, when they think of public health, they actually don't know they know what public health does, but they've probably never met a public health worker in the same way. And so in their mind, it's probably medicine. And so I really think that we have to have better integration of public health and medicine. And one thing that's not lost on me is that over these past 2 years, I've had conversations with lots and lots of people about COVID vaccines. And a common feature of the conversations I've had with people who haven't yet been convinced of the benefits of these vaccines is often that they don't have a regular healthcare provider.
Right.
So we really, I think, need to understand how people come to health issues and make sure that they can be served by health care providers and public health in their day-to-day lives, and not just kind of show up in people's lives in the midst of an emergency and sort of expect automatic cooperation and partnership.
Such a good point.
Well, Dr. Nuzzo, thank you so much for your important work, your contribution to the public's health, and for joining us today. And thanks to our audience for joining us. You can learn more about Conversations on Healthcare and sign up for our updates at chcradio.com. Dr. Nuzzo, thank you again so much.
Thank you for having me. I appreciate it.